Believe it or not, I had no plans of opening a clinic, did not know how I would do it. It just happened. It was faith. It was God leading me in that direction. I was led to this because I decided that to run for office. I was told I could keep my job. And then after being elected, I was told no, I could not. I had to leave that job. So what do? You follow your passion. My passion is to help people, so we decided to open an after-school and summer school program for children. And as I mentioned, that led to the clinic. I believe if you follow a path, it's going to happen. You don't have to know what you're going to do and how you're going to do it. We were all born to do something in life. And we all want to know. We want to know the facts. We don't walk in faith. And when we start doing that, we start trying to determine what we're going to do and how we're going to get there. And you may be led in another path. We had a broken down car vehicle in our yard. And my mother decided that the person was trans. If it's in our yard, it shouldn't be there. So she told him he had to leave. Found out that this person was homeless and hungry. She had called the police, and the police came over, and before she would allow them to leave, she told them, look, you can take him out of the yard, but make sure he has something to eat first. So she actually paid before they took him off. And after seeing that passion in her, I decided that's something that I want to do. I want to help people, but I just didn't know how I was going to do it and what I was going to do.
Someone's on the phone, 3 o'clock in
the clinic started out very small. We started, as I said, we were open 2 days a week on Tuesdays and Thursday mornings. Georgia State University staff and students were there to help us, and that was the only staff that we had, medical staff that we had. We did forums, we did, of course, the clinical work, and we also did health fairs. From there, we created a childhood obesity program, and we started teaching on childhood obesity, and from that it grew to where people started to know us. The community was right. The newspapers was writing about what we were doing and who we were, and Helping Hand Health Clinic decided to grow. And as we grew, the needs grew. So the newspapers started writing about our needs and needing help, and nurses from Rockdale County Hospital, DeKalb County, and other groups came together to help us in the clinic. And we've been in existence now since 2005. We do hypertension, we do diabetes, we do basically women's wellness, acute and chronic illnesses. We have programs in which we're not able to do ourselves, but we have partnered with individuals for getting pharmaceutical needs. Helping Hand Health Clinic, free health clinic, by the way, it is a free health clinic. We decided that it's just not enough to treat an individual and tell you have an illness and let you go. We have to follow through. We have to make sure that you are well, that you're on medication, that you're getting your medication. Individuals that can't afford it, we have what we call our pharmacy assistant program, in which we pay. It's not you don't pay anything at all. Well, we don't pay as individuals. We put you in the program and they pay for your medication. So it's coming from pharmaceutical companies. When you're looking for patients, it's not that we go door to door, looking for patients. It's not where we solicit organizations to send us patients, although we do try to work with churches. The VA, we're interested in getting veterans into our clinic that can't get the service in time of need to come into our clinic. And we speak with congressmen, senators. Senator Ronald Ramsey is one of our biggest supporters. He has actually came to health fairs and presented himself. He presented us with an award, and this is helping us. This is getting us into the media, it's getting us out into the public's eye, it's getting the interest of physicians and people that can help us in the clinic, and it's bringing those people forward. So when we say we're going out looking for them, we're not going to knock on your door and ask, do you need help? But we are going to go to other organizations, we're going to go to churches, we're going to go to politicians, we're going to go to lawmakers, and we're going to ask them, do you know someone in need? We're going to introduce ourselves, tell them about our clinic, and ask them to spread the word, and if they know of anyone or know of anyone that knows anyone, to send them to our clinic.
Senator Ramsey, we really thank you. Helping Hands very appreciate you so much. I know if you remember back in 2009, you came to us when we didn't have any fundamental means, ways of making light water bills for the clinic to serve our community. And you stated, you did a quick, immediate fundraiser for us to be able to keep the doors open at Helping Hands. And we want to thank you for that. We're able to see over 4,000 people because of your cause. And we are proud to say that you are part of us and you believe in us. And we're looking forward for you to be a part of us as we go on this road to be a successful outreach for your district.
The first thing that we do is we would do lab work on them. We would take the vitals, we would have lab work done on them. We would find out what their needs are, and we would provide them with a nurse that will take them in, do a physical on them. We will get the results back, find out if they need to be on medication and so forth, and then we take it from there. But there are individuals out there that basically, you know, when you're accustomed to making $40,000, $50,000, $60,000 a year, you know, what we do is we get to the point to where we're self-sufficient. We don't need anyone. We don't know how to ask for help. You know, and once you lose that and you do need help, you really don't know how to ask for it, or you're afraid that people might look at you, you know, in a disgusting way. So you're afraid to ask for help. We're out there to let you know that we serve everyone. We know the needs, we know the desires. I myself, you know, have been unemployed. My wife has been unemployed. Everyone that's a volunteer in our clinic has needed our services. You know, so when you walk into Helping Hands free health clinic, you're not begging, you're not asking for anything that any one of us might need at any given time. And we treat you that way because we understand. Call us at our phone number, which is 770-860-9545. And our address again is 1733 Lake Rockaway Road, Conyers, Georgia, 30012. Okay, and you can call our website is helpinghandsgeorgia.com. You can come in there. It's helpinghandsoutreach@earthlink.net.